At this time, I want to reconvene the special meeting here at the Administrative Boardroom. And at this time, I want to turn it over to our co-chair, Commissioner Pope, if you will.
If you will, please join us. I invite Commissioner Godwin to please give the prayer for us.
Let us pray. Father God, we thank you for this day. We trust that you give us that wisdom, that knowledge, that understanding. Thank you, Lord, for each one here, for the work that they do. And we can do nothing without you, but we thank you that you give us the strength, the knowledge, the wisdom to be able to move to the next step. And then give us favor, Lord, that what we do, it increase what Sampson County needs to do. And so, Father God, bless us as we continue to do the work that you have us to do. And we give you glory and honor. In Jesus' name we pray. Amen.
Amen.
Please join me in the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
All right, at this time, I'll entertain a motion to approve the agenda.
Make a motion that we approve the agenda at this time.
I have a motion and a second to approve the agenda. All those in favor? Motion so carried. All right, again, to start the meeting off, I want to welcome everyone out today. I know y'all are excited to be here. So we'll get started, and I'll turn it right on over to our county manager, Mr. Allen, if you will, run with it, sir.
Thank you, Mr. Chairman and Commissioners, and yes, thank you for everybody for being here. You can see the excitement on everyone's face. So looking for a very positive evening, though. Just a couple things I wanted to share with you. First of all, Commissioners, you will see we tried to make things a little easier for you this time, I hope, with having copies of the individual department budgets. You'll see that you have those spreadsheets. The other thing you'll see is that you have a copy of a PowerPoint presentation. That will be Miss Wanda and the health department. They'll cover that. They're the only ones that actually have a PowerPoint presentation they'd like to cover with you. So I wanted to explain that with you as well. Beyond that, just one highlight or a couple of highlights I want to mention about the evening as we go with a couple of departments. As you know, Commissioners, you've tasked us with trying to think very differently about how we approach positions and management, and anytime we can gain any efficiencies or look at things through a different lens. And so we have tried really hard to do so. As you know, whenever we have the inspections and planning department present tonight, as you know, that department has presented a tremendous amount of challenge for us in terms of recruitment of a director for that department. And as you know, we also currently have a vacant department director position for Public Works. And we obviously, as you also know, we have Ashley Holland serving as the interim director in that department. And thank you for that, Ashley, and we appreciate his availability. And I have spoken with the people, concerning these departments, that they understand that what we're looking at doing, though, is we are looking at taking both of these director position salaries, and we're planning to utilize those. We're proposing to utilize those to create an assistant county manager position who would be specifically in charge of those departments, but would also be available to help in other areas of county management as well. So I just wanted to make it clear that had been proposed and share that publicly with everyone. In addition to that, what we have proposed and we'd like to be able to do is to hire a county engineer for the water department that would be paid for out of the water department. That we feel that it would be very important to have this position to help with the design and development as growth continues. We know that eventually there will be much more growth coming into the county on down the road. We think it would be good to have that to help kind of get at the forefront of things. They would also, this person would also be able to help alleviate some of the, maybe not all of the expense, but certainly a good portion of the expense associated with contracting out for various engineering services as we're currently doing for that department. So we would see that being a benefit, and that county engineer would report directly to the county manager as well. We would not propose that that position supervise people in the water department. We would continue with the current structure related to maintenance and water line breaks and things like that within the current structure. And then the water person, the engineer, would specifically be over that area and again report directly to the county manager. So I wanted to share those items of interest with you. And unless you have any questions at the moment, without further ado, we can go ahead and ask the health department to come forward since she has a presentation to cover with you. And thank you, commissioners. Appreciate it. Thank you.
So good afternoon, everybody.
Good afternoon.
We're very glad to be here. Silly. I did bring today, I think most of you know, Tamara. And about Kelly Perry, she's our director of nursing. I kind of wanted her to sit in with us today as we walk through some things that we feel are very important to us. What I'm going to try to do is talk about, sometimes it's very confusing for us to explain our federal, state, local dollars and that kind of thing. So today, as it refers to my budget, I'd like to talk about state funding and how that happens, how that occurs, and how we have been affected this past year due to not having staff to provide services. So mainly recruitment and retention, and looking at how it affects not only county dollars, but my state dollars also. So with that, we're going to jump right in. If you give us a few minutes, we will have plenty of time for questions or whatever that you all may have for us. So this is going to be an overview of the state statute rules. It's not all of them, it's just a very, very broad overview. We can go as deep as you all want us to. Tamara.
This first graph shows that our payer source breakdown, and if you'll see 30% of our budgeted is county, 15% is other, which consists of insurance and patient pay, 17% federal, which is Medicaid and federal grants, 38% is state funding, which are our agreement addendums. Also, we want to note that within that state funding, only $10,000 goes to environmental health through the food and lodging. So that's the only state funding that environmental health gets, and that's through food and lodging.
And the rest is food service.
The next one shows basically a breakdown of what we've got. The blue line are insured, and then that would be Medicare, Medicaid, insurance. The red line is patient pay. And if you'll see, we're about 50% patient pay, 50% insurance. The fun thing about patient pay is we use a sliding fee scale. So we don't know when the patient walks in the door if they're going to pay 0 or if they're going to pay 100% or if they're going to pay 40%. We don't know until they go through eligibility. Roughly 50% of our patients are uninsured, and they fall on the sliding fee scale at different ranges.
Our next slide is just where does the obligation come for the health department to provide services? It's through the Commission of Public Health, and we are authorized to establish they are authorized to establish reasonable standards governing the nature and scope of public health services. And there are service rules. We are one of the most statutorily type of program that you will see us in environmental health. Everything has a state statute or something that goes along with it. So we wanted to make that very clear. We don't do it because we want to, but usually there is a mandate that goes behind it. The next one is some of the rules. Health department shall provide or ensure the provision of 12 specific services. And those services, I've got most of them up there, but with the exception of home health and dental public health, we don't provide those services. But as you look down that list, you'll see something that are mandated or insured. So that gives you kind of an overview, and these are by general statute, just to give you an overview. State funding does flow through most of these. AAs, I don't know if you all have ever heard of an agreement addendum before. That's what they're called, agreement addendum. They establish the rules for services. Each addendum for each program will tell us what to do, how to do it, when to pour the money down, and then there is in the end where we have our consultants to come in on most of our programs, and they will go through and review, make sure that we are doing what we are supposed to be doing. So not only are we having to abide by those rules, but then we are also have folks to come in and we'll make sure that we are doing what we're supposed to be doing based on those different agreement addendums. Currently, I have 15 agreement addendums with different programs and that kind of thing. So just to tie them both in, not only do we have different rules, whatever. Health department services are also tied to accreditation. We just went through accreditation last year. We did pass accreditation. And as you can see, a lot of the issues that are things that we have to meet on accreditation is based on the services that we provide. Now we're going to talk about the consolidated agreement addendum. I'm going to give you a very, very high level. Consolidated agreement, that's the one. It's a thick packet of information. It tells us responsibilities, expectations, underscores the laws and rules that have to be followed. It covers activities which the health department will receive funding. And we don't do anything without reviewing that consolidated agreement. It tells us if we decide we don't want to do a program, we have various guidelines set for everything. And it includes rules and, like I said, rules and regulations, funding stipulations, fiscal control, and then personnel requirements for each one of those agreement addendums. If there are personnel involved, that's where we'll see who and what as far as that's concerned. Enforcing the law and the rules, there are things that I have to do. We have those rules, they're adopted by the Commissioner of Public Health, and they come down through us, to you as the county commissioner, since you are the governing body, for your approval. And that's why you'll see a lot of times on the addendum, on the your meeting in that from the health department, because you are my governing board. So that's why we have to send things to you for your review or your approval before we can do that. Even if we are consolidated, it still comes down through you as the county commissioner. So you are my governing body. This next one is an example of a mandated agreement. It talks about communicable disease. It tells you what we shall do based on general statute. Designation of a staff member who is completed approved infection control training to direct activities, TB, STDs, other infectious diseases. The big one now, what is it? Hantavirus. That's coming through public health. We're learning some things that we didn't know about as far as that's concerned. We cannot charge the client, but we can bill third-party payers. We've got infectious disease. We cannot charge you to come in and receive those services. That's what that state funding is for. Those things that are that we are obligated to do. So we cannot charge for those services, but we can bill third-party payers, such as Medicaid, Medicare, Blue Cross Blue Shield, if they got it. And
We're in network with most insurances, Aetna, Cigna, all United Healthcare.
And if they allow us to, especially when you come to STDs and some of the other infectious diseases, they say, no, I don't want you to bill my insurance, and we cannot do it because there's that confidentiality piece that may be in there. Surveillance, we have to do surveillance reports. You see us doing a lot of that, followed up with diseases such as pertussis, help me remember, Kelly, pertussis.
E. coli, those types of things.
We have to do surveillance and follow up for those. We go into the schools of where we need to go. And we also have to examine, investigate, and control rabies in that we don't want, we do have folks to come in for vaccines, and we follow a number of rabies cases here in the county and the state. This is another example I wanted you to look at, family planning program, our family planning program, and another administrative rules. One thing I want to really point out is that when we provide those services, clients at or below 100% of their poverty level will not be charged for family planning services. And this is where our sliding fee scale comes into play. So if I see maybe, and Pamela's going to explain that, if I see 50 clients that is receiving family planning services, 25 may pay, 10 may pay, 5%. And this is something that I've struggled with my whole time at the health department is you can't really, for each budget, we struggle because we can't really, all we can do is give it an estimation because we don't know where people are going to fall when they come to these different clinics. And it's not just family planning, it's maternal health, it's child health, help me out, is there another one? Maternal, family planning, child health, adult health. And even some of the immunization things, we have to look at that and slide off if families cannot afford it.
We've referred to the sliding fee scale a few times, and this is just an example. And I just picked a family of 4. So, and it's household income. So that would be whoever's working in the home, husband, wife. If somebody's living with their uncle or their aunt, we have to get the household income. And for instance, a family of 4 that their income's between $45,376 and $57,750, they would only have to pay 40% of the cost of their services. Now, they don't have to pay that 40% that day. So if they're 40%, let's say they get an Nexplanon or Mirena, it's $1,500. And their 40% falls in there with everything they've done. We ask them how much they can pay that day. If they can pay $20, then they sign a payment agreement to pay $20 a month, or they pay a month. And as long as they pay for 3 consecutive months, we don't send them to collections. If they miss a month, then they get a collection letter, and then they get a debt set off. We have found with sending the collection letters here lately, when they get those, they will come in and settle up their bill. They don't want their tax refund to be taken. But also a family of 5, $67,691 to $82,195 household income is 60% pay. I just tried to pick some that were the average size around Sampson County. And we have some with more, some with less, but that's just an example of our sliding fee scale.
And we go around and around with people sometimes because they'll say, well, health departments aren't supposed to charge, or all the services are free. No, it's not free. Somebody's got to, there's just some things that we have to bill and receive fees or service. That helps us with our fees. So but this is something I've always struggled with, is how do you budget, not knowing what's going to happen towards your clients and where they're going to slide and if they are insured or not insured. So this slide just kind of show you some of how many services we provide. This was for last fiscal year, 4,000 services in family planning, child health, and maternal health, 1,600 in TB, the TB program. Not to say we had that many cases, but following up and things that we provided in that service. Communicable diseases, this sometimes can really make you think twice, but believe it or not, maternal health and CD is one of 2 of our largest programs. And they are the ones that, if they walk in that door, we are by mandate, have to see them when they come in that door, because those are the kinds of things that we don't want out in our community spreading, which is only going to make it worse for us. Immunization. Yeah. Immunization, over 6,000 visits for immunizations last year, just to FYI. And we're the only place, I think, on Goshen, Maine that provides immunizations to all those 0 to 18 or 18. And we also have some private pay folks
For the state vaccine.
late vaccine. So, nursing staff, this is where it's really hit us this year with my state funding and some of the other funding. I have 3 nurses that's federally funded, no county dollars. One of those nurses is on medical leave right now. I have a week nurse, and she's completely federally funded. There's no county dollars in that program. But the clinic is where we get some issues in it. I have 7 nurses and 1 advanced provider. It's partially funded by federal, state, local, and county. So we have funding coming in from all sorts of places. And Cameron has a job of keeping all those separated and having to pull the money from where it needs to come from and where it needs to go. And our rule is we're going to spend
We pull state
state
first.
first.
State and federal first, because some of them are only federal dollars before we, and then we tap into anything we've collected through insurance or local, where people have paid, and then we tap into the county. So the county is the last
resort.
the last portion of the funding that we tap into on a monthly basis.
And I also have one nurse that's in the clinic that's on maternity leave. Not maternity, but military leave, getting my words all messed up. Military leave, and she's been gone, she's been gone about a year. We're hoping that she'll be back into the office, hopefully the end of June or July. But she's been gone for a year also. So that's one that is right now in place. So 11 total nurses, but as you can see, yes, on the next, I'm going to let Kelly talk to you a little bit about what she's experienced over the past year.
So just this fiscal year, which is, July through April, we lost 3 nurses and an advanced provider, which hit us really hard. And then on top of that, November through March, we had 2 nurses in the clinic, which that 2 nurses includes me. So it was me and Emily. And of course, with a lot of administrative duties falling on the DON, you can imagine a lot of the clinic face-to-face patient operations landed on just our 1 nurse. So we struggled. We might have struggled in numbers, but not in heart. But we were able to get through it. We had 2 out on maternity leave, and 1 resigned in March. So once her maternity leave was over, she did not return. Currently, we have 4 nurses, and that includes 1 contract nurse. We've experienced ongoing challenges with recruitment and retention, leading to persistent staffing shortages while demand for public health services continues to grow. Despite the challenges, our nursing staff remains committed to serving the citizens of this county. We greatly appreciate the county commissioner's willingness to hear and review our proposal for salary adjustments aimed at improving recruitment efforts, retaining experienced staff, and ensuring the continued stability of essential public health services, as Wanda talked about earlier.
In closing, I do have 41 positions. My vacancies right now, I'm sorry, that's not correct, should be vacancies, is, as you can see, we're top heavy with professional staff. That's my nurses and my advanced practitioners. And those programs are very important to me, especially my maternal health program. That's the nurse that came and decided she didn't want to come back after she went on maternity leave. That is a big program for us. So you can see that I've had 3 or 4 people to handle all the other programs plus these, and to try to make sure that we are meeting our goals. And we work very closely with the other providers in our county, and feel comfortable that they feel comfortable that they allow us to do the things that we do. So, in looking at this list, also still, that PHN2 is on military leave. Can't get that straight, sorry about that. And then I have 1 environmental health specialist that's still vacant. Also, Reed, who was the last environmental health specialist that we hired, just passed his test, so he's now a certified environmental health specialist. And that takes about 2 years when you hire somebody new to get them certified and where they need to be. So, but that's pretty much what we wanted to kind of let you see how we struggled this year and how it has affected us as far as providing services in the health department and still providing those mandated programs that we need to do in order. So I do appreciate what you all have done for us, I really do. But I just wanted to share, this is the first time we've had it like this in many years. Even during COVID, our staff stayed with us. We did not lose hardly any of our nursing staff. They stayed right there with us. And and you have to be, to stay in public health, you have to love it, or you have to have that spirit to be, especially for nursing staff. Because they can go anywhere and they can get a job, anywhere. We thought we had hired an advanced practitioner. Thought we had her. Getting ready to talk to her, whatever. Another place called her and offered her a $10,000 sign-on bonus. I cannot compete with that. Cannot compete. So we do appreciate what you do, and hopefully we'll entertain any questions that you all may have.
Budgeted full-time positions do you have?
41.
That's budgeted full-time positions? 41? In the whole department, just 41 people. And how many vacancies did you say you had?
That 1, 2, 3, 4, 5.
Because
Seven.
7, I'm sorry.
That includes the one on leave. Melissa, on the budget that's printed out here, it says that the 2026 original budget is for 5.1 million, but year to date, only 3.1 million has been spent. What is that time frame through? Is that 8 months, 9 months?
It would have been, this one would have been at least through the end of, around the 25th of April, I think. So it's almost 9 months.
Yeah.
Okay.
I'm sorry, almost 10 months.
10 months?
I do a report for our advisory committee comparing revenues and expenditures every month. And when I did it based on the April expenditures, we were at 47% of county contribution for the year. And that was through April expenditures.
Okay.
Pretty good.
I mean, based on that, it looks like if this continues by the end of the year, the health department would have only spent 3.7 million of the 5.1 million budgeted.
And it's true.
Yeah.
Because we've not had the staff, that's true.
Okay.
And we do pull state funds first, like she said, and most of my state funds are budgeted for salaries. So we had to go back to the state a couple of months ago and request to get maybe some equipment because we didn't have the positions filled. So we were able to shift some things because we weren't able to pull the money for the salaries for the position vacancies and get some equipment like a handicap exam table that we've been needing for ADA compliance.
Okay.
And unlike county dollars, it can roll over. State dollars do not roll over from year to year. If you don't spend them this year, you may not get them back next year. It's population based. And they say, I'm gonna give you X amount of dollars based on your population. If you don't spend that funding, you may very well lose it. That's another piece for us.
On your revenues, you're showing on page 1, and I realize we've redone our accounting practices with breakdowns of different things, but I noticed there's a $42,000 reduction on state assistance, $58,000 for state assistance TB. Have we lost that total, or has it just been redistributed into other revenue funds?
We did lose some for TB, and it's based on the number of patients. So they look at how they average it out several years, and the state bases that. So we did lose that for TB. And the CD part, they reconfigured CD, STD, TB, STD drugs, STD prevention, HIV prevention, and they put it all into one little bundle. So we did not lose the whole 58, but it was kind of reorganized. I would say maybe 35 of that 58.
And we did make up that difference, so by pulling from some other programs. But we're not asking I mean, we make up the difference, so.
Any further questions from you guys? You good? Thank y'all. We appreciate what y'all doing. Y'all were understaffed, and I know the money's changing on you. You're not sure what's gonna happen from day to day, but we appreciate what y'all doing.
Thanks a lot. Thanks for working on it.
And you give us something we can look at. Seriously, you really have. Thank you. All right. Parks and Rec Senior Services. Hello.
I just wanted to start out, I know Commissioner Godwin, you asked last budget meeting about the landscaping.
Yes.
And so I wanted to kind of highlight, last year when we were talking about the budgetary issues.
Yes.
One of the things that we proposed were between us and Public Works, meaning Parks and Recreation and Public Works, that we would split a lot of the lawn care contracts. This is who that falls on.
All right.
And this is Brad Richardson, and he has a staff of 2, and then he has a part-time person. So he's responsible for doing all the lawn and maintenance here on the grounds for the complex and also the expo center. So Wiley has been a huge help when he has some of his clients, we'll say, that can help. But so far this year, he's not been able to do that because he doesn't have ones that travel. And we also had a vacancy with Brad's staff for the past couple of months. So when we have that, we're kind of different from other departments. We can't just say we're going to stop doing that for right now. Brad has to do it. His position does not get paid overtime. And so how it works is if it rains Monday through Thursday, then his guys work that weekend. And they just get comp time. So I just kind of wanted you to understand, how that works. He does an excellent job. We've had tons of compliments since he's taken it over, but I didn't want to take the credit for that. I wanted to make sure that you guys see who does all that work.
Yeah.
And now you can hear the board. And he's actually just come off the mower, changed clothes to come here, so thank him for being here. But we pretty much tried to hold the line for this year, just like last year. So we really didn't make any changes.
How many employees do you have budgeted? And how many vacancies do you have?
For senior services, we have.
For recreation?
For recreation,
Yeah.
7.2.
Budgeted?
And that is, my position is 70/30.
Yeah, because part of the.
And I have an administrative person who's 50/50 with senior services, so that's how it kind of.
Okay.
Vacancies, we have none, but we have 3 employees that have been here 6 months or less. 1 that's been here for a month. And so our issue is when we have a vacancy, it takes a while to fill. So it could take up to a year, and then you're just trying to fill in. And that kind of becomes a challenge. And we're fortunate to have me because I'll fill in. But it is taxing because you have somebody that's working 12 to 14 hours some days. And like I said, with Brad, you're coming in on the weekends and stuff like that. So it's not necessarily that you have a problem all the time, but when you do, it's usually for a stretched out period of time. It's trying to find somebody. Because like right now, we don't have any vacancies, and right now all these kids are graduating from college. So if we have a vacancy in December, we typically are not going to be pulling people that have been without a job for 2 or 3, or have been in the field for 2 or 3 years because we're an entry-level position. So usually we just get people coming right out of college, so that's what can cause an issue for us. And then as far as Brad's position with maintenance, for a maintenance assistant, you're not going to get a skilled laborer for that position, because if you get a skilled laborer, they're going to be getting paid a higher rate of pay. So usually he gets somebody that's been a part-time person, that, you know, wants to move into full-time but doesn't have a ton of skill, and he then takes on the responsibility of trying to train.
For your senior services, how many positions do you have
11.8.
and vacancies?
No vacancies right now. We were without somebody at one of our senior centers for 9 months, and we just started somebody, she's been here for 2 months.
Okay.
So again, that just kind of falls on your other full-time staff, because those positions are state funded, so you don't have the option to close. So somebody has to fill in for you to receive that money.
Alan and Melissa, is the timeframe on recreation the same as it was on health department as far as reporting?
Yeah, this would be 10 full months. It'd be 10 full months. It was a little bit after that when I did this budget.
Based on where your actuals are, it looks like you may run over budget this year, unless there's expenditures that are front-loaded that you've already absorbed.
We're not over in any account, so I don't know where that is coming from.
I was just, I mean, you budgeted $865, and year-to-date so far, $107,000 has been spent, divided by 10 months, times 12, that would put you at $968,000, which is $100,000 more than what's budgeted.
There's nothing that's over, so there's got to
Yeah,
be something that's incorrect.
typically what we do, starting towards the end of the month, the end of the year, like the last 3 or 4 months of the year, fiscal year, we have a staff member that will go through all the budgets and like whatever period you're at, like if it was the end of March, that's the 9th month, that's 75% of your budget would be spent, or your revenue should come in, and they go over anything that's over 75%. They have the department head go over and review it.
Capital outlay.
Yeah, because we'll actually won't spend all of our budget because of full-time, being without that full-time staff positions. And then we were also, it's a challenge right now to find people for part-time. A lot of, we usually recruit teenagers to work after hours, and right now there's not a lot of teenagers in these jobs. So I keep about 30 on staff, and just kind of give you an idea for recreation. I have 25 to 30 on staff, and when they turned in their time sheets for this past month, I had some that worked 5 hours for the month. That's what their availability is. And then I had some that worked 40 hours, and some worked no hours. So they really are very inconsistent, and it is a challenge to find people, or find high school or college age kids. They're just so busy doing extracurricular stuff, it's hard for them to work consistently. So we keep a ton of kids on staff just to try to plug in.
Your capital outlay for $256,000, what was that for? Was that an air conditioner?
Playground.
Playground?
And that was all grant money.
Okay.
Pretty much that was paid lump sum on the front end, so that would eat up a lot of your percentage on your expenditures.
Yeah, and then they actually came back and gave us almost $11,000 to fence around that playground after the fact. So you'll see that in this new budget. It won't be on this because they haven't deposited that money yet, but it will be probably on the next budget report.
Take a fence on that too.
Yes, sir.
Good deal. That should look very nice.
We've been very fortunate to receive a lot of support. And then for the senior services side, the same thing. E. Black and Associates does a senior fair for us where she charges vendors, and then that money is used toward, sometimes it's used toward capital items. It was used toward computers, toward some of the senior sites. It's fixed doors at Garland, repaired ramps, things like that we don't have the money, and the state funding money cannot pay for those things. They can only pay for it for citizens. And so we're able to help do some things like that with that money.
The money for the seniors who are, I guess, destitute, where you can basically tear their house down and build a new one, is that federal money or state money?
We don't have that program, but it's,
That's not through your department?
we actually don't do that program through the county anymore. After Juanita retired, I think that program was no longer, but it's federal money, but it's administered by the states. It's a worthwhile program, it's just kind of not having enough staff to administer the grants, I would say.
We're probably about the only county that don't do CDG money funding. Because all the rest of the counties do it. They help citizens with housing, fix them up, purchasing new ones. We just don't do it. It's something we need to look into because we've got a lot of residents that need houses repaired. And some of the houses torn down. It was a good program because I have referred a whole lot of people to it.
Very good.
Is that program something that the grant monies can be used to pay a contract administrator to oversee that for the county?
I'd have to look back at my notes from when we talked to Juanita about it. The biggest issue with that is you'd have to have an administrative assistant, and at that time, our administrative assistant is already doing administration for several grants, and we just thought, unless we can get a whole nother person or share some of those responsibilities, and our budget just wouldn't allow, the county budget as a whole wouldn't allow to add on another full-time person.
And if I may add, I worked with Juanita a lot, so many years ago with that program. And while they do pay for the administration piece, there's still a significant amount of labor that's got to be done from the county side, maintaining files and making sure all the I's are dotted and T's are crossed, for monitoring visits and stuff like that. So it would definitely kind of more staff.
Yeah, it's definitely a worthwhile program, but just, it just at that time
It is,
was not
there's
feasible for.
CDBG, and then there's the North Carolina Housing and Finance Single Family Rehab Program. There's two different programs that were being administered, and the waiting list, I mean, it never ended. There's always a lot of people on that.
She was totally focused on that, right?
She started doing purchasing and contracting for the last few years as well.
Yeah, for that particular program, she contracted it out, but one of the issues that we kind of ran into, they were handling part of the admin, and then after they're completely done with that project, we're responsible for all those files. So even though they were doing the admin work during, they left off some things, and then that's kind of dropped in your lap. So that, I would say that's a huge concern to trying to contract that out, to give it to one department to run, and then contract it out to somebody, let them handle the paperwork and stuff, and then put it in a file, because when they come back to monitor, as Melissa said, you're responsible, and what that responsibility means is you might owe back money.
And there's ongoing monitoring of the files, because typically they'll do a lien on the property for 8 to 10 years so that the person can't sell the property and make a profit off of it. You've also got to be tracking those so that you can go in and release the liens when the time frame comes up.
So it all has its, ebbs and flows and positive and negative to each thing.
You good?
Yeah.
Commissioner?
Thank you.
Thank you.
Thank y'all. Cleaning and Inspection Department. After enough.
Hello. I am next on the agenda, correct?
Yes.
Okay.
It's on you, you just do your thing. Does everyone know?
So what else want to
That's
say,
all I
Mr.
want to
Chairman, if I
introduce.
may, I'll introduce Alyssa. This
I'm
is
blessed, I
Alyssa
already know.
Garcia, Commissioners. She has been helping and serving the county in an interim capacity in terms of the interim director
Okay.
position for the department. And so, anyway, with that said, though, she was more than happy to come in and present the budget and talk through some of the concerns and issues and what have you with you. So I'll turn it over to Alyssa.
Well, good evening. Thank you for
Good
having me here tonight. As Mr. Van stated, my name is Alyssa Garcia. I'm with Mid-Carolina Regional Council. I've been helping out the county in various capacities over at planning and inspection since October 2025. And tonight I'm here as interim director to present the recommended department budget and address any questions that you have. My goal tonight is to present a high-level overview of the recommendations, highlighting the key items and addressing any concerns or questions that may arise. To review from the budget packet that you all have, in FY26, the expenditures were at $895,000 approximately, with our revenues projected to be approximately $801,000. The actuals provided in your FY26 indicate revenue at $547,000 and expenditures at $512,000, so a little bit more of a positive outcome there. I would also like to note that the mid-year actuals do appear light against the annual projections, but that's consistent with how the Planning and Inspections Department typically operates, with heavier permit flow coming in during certain quarters of the year. For fiscal year 27, the projected revenue, we are looking at approximately $839,000 and expenditures at $825,000. The department is projecting to increase our revenue by $38,000 approximately and decrease our expenditures by $69,000. So overall, this projects a department-wide budget decrease of $107,948. For FY27, the justification behind the increase in revenue is an anticipated increase in building permit and inspection permits and planning fees, with anticipated continued residential and commercial growth throughout the county, as well as re-implementing previously established fee structures, such as charging for re-inspections for failed inspections throughout the year. This budget also projects a large savings when it comes to personnel. We would be reducing the salary budget by approximately $74,000, removing the director position. This department, as well as two others, would instead report now to an assistant county manager and have in-house supervisors or managers to handle the day-to-day functions of the departments. We have also eliminated the bonus pay line item of $4,500 from last year, as well as maintaining the two currently vacant and advertised positions with anticipated hiring over the next several months. Even with the budgeted 4% COLA for existing positions and staff, the downstream effect of eliminating these positions is an overall reduction for the county expenditures in FICA, Medicare, retirement, 401k contributions, and group insurance costs. We've also anticipated some operational reductions, such as reducing the advertising budget from $3,500 to $1,500, and travel reduced from $9,000 to $7,000. That is to account for more regional, local trainings for staff, as well as more digital advertising as opposed to the cost of print advertising. Books, supplies, and office materials have all been brought closer to what the department actually expects to spend based on quarterly snapshots. And we did increase the employee training budget from $3,000 to $5,000 to account for the required inspector trainings, as well as budgeting for new staff training as necessary, and to encourage staff development and retention. The largest single line item you'll note is the contracted services. This also accounts for moving $24,000 from part-time salaries over to contracted services.
As part of that, Mid-Carolina Regional Council has been regularly assisting the department during periods of recent transition with staff, and we would plan to continue to do so on an as-needed basis. But the main cause for increase in this line item would be to allow for contracting with third-party building inspectors. As you're aware, the department has been in a period of flux with the retirement of multiple staff members and unforeseen turnovers, and currently we remain without a level 2 or level 3 building inspector. Increasing the budget for contracted inspections allows the work to continue without the overhead from the county for full-time positions and benefits. To close, this budget is requesting $825,613 to operate a department that is projected to bring in $839,456 in revenue. The department has cut spending responsibly and maintained and improved service levels, and will continue to invest in our staff and address the needs of our growing county. And this concludes my presentation, and I'm happy to address any questions or concerns that you all may have.
How many budgeted positions were there in the current budget?
In the current budget, we have 4 inspector positions across varying levels, 2 planners, and 2 admins.
So was that 8?
Yes.
And you said you currently have 2 vacancies at level 2 and 3 inspector.
We have 1 building inspector position vacant, and then the director position, which has been removed from the budget.
Okay, so 2.
And then a planning technician.
So 2 vacancies.
Correct. And they're both currently advertised. So we hope to fill them before the new fiscal year starts.
And as outside observer in some regards, since you come from Mid-Carolina, what is your thoughts on the idea of eliminating the director position and merging it into the assistant county manager position?
I think if done correctly, it could benefit the department. They have very experienced staff in the admin and the planning supervision roles, and they have been maintaining the department basically and keeping the day-to-day functions going. And so I think if we were to transition into a more manager position for that section, it would flow seamlessly to an assistant county manager while opening up that salary. And so the inspectors, they typically have kind of their own hierarchy. So whoever the highest level inspector is, they kind of automatically go to them to shadow, to report. And so that just maintains the reporting to someone above them to make sure everyone is being held accountable for the work.
What is the current average lead time for an inspection?
We are scheduling about a week out, so we're not behind. They've caught up that delay that they had during the original turnover earlier in the year.
Thank you.
It's kind of strange because you talk with builders that are here in Sampson and they complain about the time, but then you talk to a builder that's outside of Sampson that's building in Sampson and they brag about how great the inspections are.
And we see that a lot across jurisdictions as well, in Cumberland and Harnett. But most times, we've implemented a 3:30 cutoff. So if they contact the admins before 3:30, they are on the schedule for the next day. And if for some reason they aren't, it's the following day. So that's about as much lead time as they'll get, unless it's a very specialized or higher level where we have to do more coordination.
I know we changed some of our pay schedules and the way that people were paying. Is it possible, because I got this question thrown at me this week, is it possible for someone to pick up the permit and pay at the same time?
Usually they would need to pay for the permit prior to.
I think that was done, but they were told they had to do, everything had to be received online.
Online. Well, the staff has the ability to create an invoice in person and process the payment online. So it just depends on how the information is being input, whether it's from the customer or from staff.
Well, this person was an older person and they just didn't do that. And they like hands-on. Didn't take me long to understand that. So just kind of, I want to move to the next generation. Don't get me wrong, we're moving forward and I appreciate what you're doing, but I want to also know that we still got a lot of people we need to be looking after this.
Of course, and we do have a kiosk set up, so if staff do need or to assist or kind of walk through how to use the online system, they can take the time to do so.
Thank you. More questions? Good? No good?
Thank you.
You're welcome.
Thank you.
Yes, thank you.
Thank you.
Expo Center, you're up, dear. Thank you.
Good afternoon.
Good afternoon.
Thank you for having me. So as far as my budget goes this year, it has increased slightly, and that is due to last year, our full-time janitor position was cut, not full-time with the county, it was a full-time contract employee. And that was removed this past year, and we have hurt tremendously because of that. And that is something that I have added back part-time. I didn't ask for full-time, I did ask for part-time, just because we do really need somebody in the facility at least 2.5 days, 3 days a week, depending on the week. It's something that is, corners of the building get left behind, kitchens don't get cleaned properly. And last year, the goal was to have either Kelvin, who does our setup and breakdowns of the, chairs, tables, flips, or, keep our janitor, and we really couldn't go without somebody doing those large setup and breakdowns. He does clean, but he really just covers the light surfaces. He gets what he can and he makes it presentable for the next event. But without somebody for a year, there's a lot that goes on in between the times that he's able to be there that needs addressing. So I have put in for a part-time janitor. Lawn care is something that Parks and Rec was doing for us this past year, and it's my understanding from Mr. Van, they did add in an extra fee for us to have somebody come in contracted to come in and do our lawn maintenance this year, so there is an increase for that as well. And we will work to get bids out for that.
Can I jump in with that? Commissioners, we did that because it was becoming such a problem for Dana's team with everything else they're doing, and it would actually take them away from some of their main duties. So that was the thought process there, to give them a little relief.
Yeah, with lawn care, it's not just the lawn care, it's the trash that accumulates, all the outside trash cans being taken out, the trash that accumulates on the grounds, just that typical stuff, and that can be a lot. So he's put it back in the budget for this year to have a contractor come in and do that. This also comes with changes for my house manager and my bar staff to become county positions over contracted services. So they will be moved to technically part-time county positions. And so, and that's something that HR, that's something that I think quite a few departments are having to move to.
Okay.
And so essentially that's the only extra thing that I am asking for this year, which has caused a little bit of an increase in my budget from this year to last year. And one thing I do want to point out that we have talked about with Mr. Van is elections in the facility. Last year, and I think they've done it a couple of years now, but they take Heritage B, and now after discussions, they would like to take some of the full Heritage Hall for certain elections that are coming up, like this fall. They'll take the full Heritage Hall over Heritage Hall B. And I broke down, this is, and I'll give this number and then I'll say, so 3 times a year is what we typically have them. Sometimes it's 2 times a year, sometimes it's 3 times a year that we have to reserve the hall depending if there's a runoff or not. And those 3 times a year, each time they come, it could potentially cost us $52,200 in revenue. That's potentially. I'm not saying that I could rent Heritage Hall every single day that they're there, so I would realistically probably cut that in half. So you would say, around $25,000 in revenue that could potentially cost us with the time that they're in the facility. And it's like this year, we had 3 time slots reserved for them, and then while they're there, or while we have those reserved, I can't rent the facility. They did not have to come for the runoff election this time, so we were able to fill in a couple of those dates, but for the most part, we had that blocked out for them up until about mid-March. So That's just, I wanted just to kind of give that perspective as to what
That's
that potentially hits as far as our rental income, just so you can see, you know, a little bit of the varying differences there.
With your changes in your part-time, adding your part-time staff that you mentioned, what does that bump your projected full-time equivalent up to for next year?
They'll still be part-time, we just have 2 full-time staff, but with them each being there, because we have around 6 house managers probably 6 house managers, 6 bar staff, and they're all part-time every month. They don't really exceed, none of them really exceed 20 hours, and all of that is received back into revenues because we charge the client for those services. So those, for the most part, equal out if we don't make a bit of a profit off
So
of
you said
that.
full-time was 2?
We just have 2.
Of course, no vacancies.
No vacancies, thank goodness.
Did it work out okay this year with the Night to Shine and the Board of Elections bid and Heritage B?
It did.
Everything went okay?
It did, we made that work, and some years that won't be a conflict, just depends on who will be there. I don't think it'll affect them for this coming up year, but it'll affect them again in 2028 and so forth. But there's still, you know, depending on what they need, for the most part, it is just Heritage B, and that's a small room, and they're still able to fit so much inside the building.
What's your most profitable type of event?
A quinceanera.
What is that?
That is,
Okay, I know. Yeah, where
picnic,
they're rented out, yeah.
And
How many of
that's,
those do you get a year?
we average 24 to 30. Some months we have 2, we have 3 coming up in June. And I also want to bring that up as well, is that this year I couldn't tell you what the exact cause is, but I feel like our bar profits were hit significantly because we had quite a few lined up that did cancel. And we had 2 specifically that really didn't want to have large events with all that was going on with ICE and just that scare. And that was a very specific thing that they brought to our attention, that they were canceling. And those significantly hit our bars, because I would say a large amount of our bars are quinceañeras. And, you know, we budget about 40,000 as income, and we've probably done half. Not to say that we wouldn't get to at least maybe 80% this year, but that has affected
And
our
they're
bars.
usually on the Prestige side,
Yeah.
never on the Heritage side.
We typically require all of those to be in Prestige Hall, because for the most part, Heritage Hall just can't accommodate the amount of people that they need.
And you still try to maximize when you put the bleachers in, so that you're coordinating that most
We
of the
do.
bleachers are at a certain time of year.
Yeah. I mean, and again, it still costs us $4,000. Those go in twice a year. They have been in since around mid-April, and they won't come out for a couple more weeks after Labor Day. But when they're in the spring, the cost of that is covered, so we do get that back.
Labor Day or Memorial Day?
I'm sorry, Memorial Day. Those come out after Memorial Day, after the schools have graduated. But the community college, the schools, we have 3 recitals. We have a large gospel event that comes. We've got the NC Theological Seminary that graduates from there. There's quite a few people who utilize those risers during that time. And then we put them in the fall series, and that's covered through sponsorships out of the community.
Okay. Thank you.
Y'all good? All right, thank you.
Thank you for that.
All right, Board of Election, you're up.
They're right there, they're right there.
They're ready to roll.
They're ready.
Hello, everyone.
Hello.
So this is my chairman, Dwight Williams, who's joining us today as we go over our budget. So we did not ask for an increase. I know there was a slight increase because all of our election workers, including board members and everyone has been moved to part-time employees. That was with the new labor law, so we have had to do that. I have 2 full-time positions. Everyone else is part-time, moving over to part-time. They were contracted and now they're moving over to part-time. So we are, I think, estimate around 15,000 less, so we did not ask for any increase with this. We do have a general election coming up on November 3rd, so we are preparing for that. We have around 38,648 registered voters in our database right now. And so preparing for, we budgeted 3 sites for early voting. That is from October 15th to October 31st, and election day is November 3rd. Registration deadline is October 9th that we're preparing for. Now we are still waiting on, as you know, the General Assembly is in session, so it has been rumored that they might actually cut down days for early voting. We have kind of like asked that to see like that would be great, that would help the county out and let them know, but it's just up to kind of them if they will cut down the days and times for early voting as well. This also sometimes push from the auditor's office wanting more early voting sites, but my chairman, Dwight Williams, has referred to them, if they are going to give the money for it, we will be glad to do it, but if they're going to give the money for it, but right now 3 sites for, well, the volume we do for early voting supplies. We have one in Harold, we have one in Wheaton Grove, and then the Central in Clinton at the Expo Center. And so, with this, going down.
If I may, while you're on the subject of the Expo Center, I'd like to thank Ms. Atkins and Mr. Van for facilitating a meeting between Ms. Rayner and myself to look at scheduling of the Civic Center. It was very much long overdue. And I guess perhaps we at the board had really not given it thought. But you guys did, and thank you for that. Ms. Atkins has very much appreciated being able to specify dates and particular parts of the Civic Center that for our use. And so it's been helpful both to us on the board of elections and to the Civic Center. So thank you, Mr. Van and Ms. Atkins, for that.
Yes, so we have gave them a 8-year calendar of what use for Expo Center, for what parts of Expo Center to be used. Now, we kind of go with guidelines for the state of that. State can come change early voting times. If it cuts, it helps. If they want more, that kind of hinders us a little bit, but also when we do our days as well, we try to do the minimum 4 days to help save the county money as well. With my board, what they vote on the plans and do, but it can come back to where, like in 2020, where the state required us to be open all 17 days. So I do budget for all 17 days, but when presenting plans to the board, it is not the 17 days that I'm presenting unless the state comes back and requires us to be open all 17 days. But if y'all can get to the General Assembly and help cut down some early voting days, y'all can do that as well. So I've gone over dates. We have not asked for increase. We've actually decreased this year also. Well, I've been the only full-time since like mid-July to March 16th, so that did help with the salaries for this year's budget. And we are starting to get reimbursed from the municipal election from last year as well, so those checks are rolling in. But
when you said there was 2 full-time positions, you were counting yourself, so that's just you and the staff.
Me and my deputy, and I finally have a deputy director, so that has been a great help, so I hope that he can help out.
In regards to the early voting days, Sampson County, among most of the counties at one point in time, had Sunday voting, maybe 1 or 2 Sundays during a cycle. And we looked at cost per vote.
Right.
And Sunday votes cost us something on the order of $212 per ballot cast on a Sunday. And it had no reason to it. And so we have not done Sunday voting for probably at least 2
Since 2022.
Yeah. For a number of election cycles now. It's just
So you saved some money.
no justification for it.
just for convenience. What it amounts to.
And then with this one, we also, when submitted to the admin office, when we were telling our personnel, we had, our candidate filing was not done yet, so we had 3 weeks of candidate filing in December instead of just 2 weeks, so kind of, we think of the volume and kind of like worst case scenario. So in April, my board went back and we did cut assistants, gauging the volume from the primary and who was on the candidates list. We had 2 Democrat for North Carolina Senate District 9 and then House 22. They did withdrew, so the state is working with the state Democrat Party to see if they have any nominees for that one. So we're still waiting kind of see on that for volume of that, and also we are still waiting to see if anyone submits a write-in candidate petition. So does anyone have any questions?
How many registered voters did you say we had again?
38,648.
38,600 and what?
48.
48.
And that can increase because the registration deadline for the election is October 9th.
I'm just curious, how many voted last time?
Which last time?
With the last voting cycle?
Primary.
Yeah, primary voting. I'm just curious.
15,000?
So total overall election for the primary that we just had, 9,573.
38,000.
We get our most volume during
General
presidential.
election.
General election.
Presidential election.
But I still have to kind of go for the 30.
I understand, I understand.
We have to print that many ballots.
It don't matter, yeah, I agree, I understand. You still gonna run the cost, it doesn't matter. That's just, some reason that doesn't jive out with me, but anyway.
Maya does, I think, an admirable job in looking at past elections, both general elections, primary elections, and off-year elections. And she looks at the volume, the cycle, and tries to budget within those specifications, trying to look into the future as best you can, not knowing who's going to run or how many for an office or how close it'll be. You put 4 people in an election for a seat, the likelihood of a runoff is about 90%. So I think she does a very admirable job in formulating the budget for us.
That's good.
Any other questions?
Yeah, we appreciate you keeping it under budget.
Yeah,
Yes, thank you.
thank you.
Thank you.
It's always appreciated.
We're done, thank you, appreciate you.
Thank y'all.
We're way ahead.
Y'all want
Hey,
to eat or you want to see?
No, you're gonna sit down and do your budget.
I'm ready to do it.
I thought you were, I can look at you.
First.
All
I
right,
thought
Brad.
I could look at you and tell you were ready.
I'm ready.
He was ready.
This is awful happy about this.
How y'all doing this evening?
Good, Brad.
All right. I'm normally off the cuff with everything I do, but I have sat down this weekend and really wrote a bunch of notes down. And I'm very prepared and I've got a lot of things to talk about. I know I ain't got a lot of time, so I'm gonna go ahead and try to get to it. So, first thing I want to talk about is the year we've had so far down at the Extension Office. And it has been a difficult year. I will go ahead and tell you that. I had one on maternity leave. I had one on paternity leave. I didn't even know there was such thing as paternity leave, but there is. I never got paternity leave. But there's such thing as paternity leave. I've had one position that retired that we've been unable to fill. I've had 3 resign. And I've sat at my office sometimes and hollered for somebody and just heard an echo because I've been the only one sitting in the office sometimes. And it's been difficult to say the least. But I will say that we have still delivered quality service to our clients this year.
And the reason I've been alone in the office sometimes is because the agents that we have has been out responding to calls and been in the field, even in areas that they're not responsible for. So, you know, my commercial horticulture agent might have been looking at somebody's grass, and my livestock agent might have been in somebody's field making sure that they're getting ready to plant it this spring. So we've been really getting things done down there. So budget-wise, does everybody have a copy of the budget that is submitted in here? Okay, I want to go down to line item gas, oil, and tires, if everybody sees that line item. When I submitted that, we had, gas was $2 and I believe 87 cents a gallon. And I want to add $1,680 to that to bring it to a total of $4,000. I'm hoping that I have an agent in the office by June 1st that's going to start driving some more. And gas, as we know, is not $2.87 a gallon anymore. So I want to bring the total of that line item up to $4,000 for gas, oil, and tires, because it's going to take it for gas. That's the only thing I want to amend in the budget right now. The next thing I want to talk about is our staffing. As hard as it's been this year, there is some light that's happened with our staffing. If nobody, has anybody heard about ag leads in here? The ag leads program that's going on. I'm gonna pass that out, or I'll pass it around. This is about you see how thick this is. I didn't print but one. That's the ag leads program. It started in 2023 by the Gold Leaf Foundation, the NC Chamber, Farm Bureau, and Google. And the purpose of ag leads is to strengthen North Carolina's $111 billion agriculture industry across North Carolina. And it started out as an idea in 2023. In 2024, they got people together to start some committees. In 2025, they started listening and putting some ideas together. In 2026, which is right now, they want to start implementing some ideas of what they've come together and done. And of all places, we have vacancies, and we're the #1 county in agriculture, and we contribute $2.1 billion to that $111 billion in North Carolina agriculture. And we're #1 in sweet potatoes and vegetables and melons and hogs and pigs and corns and grain and total crops. And we're the #1 county in the state with about 300,000 total acres in agriculture. And you may think these are people from Raleigh or some federal agency that's on this Ag Leads program, but it's headed up by our very own Ray Starling, who lives in the Clement community. Some other notables from Sampson County that's on this committee is Nelson Powell right here in Clinton, and also Ed Olive, who's the director of Mount Olive Agriculture Business School. So very close ties here in Sampson County to this Ag Leads program. There's 7 working groups in it. One area is to reinforce farmer support system. That's where they pinpointed extension in Sampson County Extension, and how we could serve farmers better. And one thing they did was reviewed our staffing model. And they said our staffing model is old and outdated and out of touch with what it should be today. They said we needed more specialization. They said we needed to be more proactive than reactive. Instead of waiting for somebody to call us, we should be out there trying to figure out the problem before it starts, or when it initially starts. They said we need to be hiring better people. They said we need better pay and better retention. I'm not here looking for a raise. That's not what I'm here doing. But our new model is based on crop acreage. The formula for the staffing model is based on crop acreage, the number of farms, pesticide applicators, waste applicators, county population, enrollment of youth in 4-H, nursery and greenhouse growers, vegetable acreage, milk sales, and volunteers. So you can imagine what that formula looks like when you plug in Sampson County agricultural numbers. A lot more than what we've got right now. The formula revealed that we need an additional 0.9 field crop agents and 1.6 additional commercial horticulture agents. That's FTEs. Now, when you start talking about ratios, I feel like the Andy Griffith show, if any of y'all watches Andy Griffith, like Opie when he starts talking about poor ratios with ratios. I don't get it all the time. But these are full-time equivalencies of jobs. So we're looking at 1.6 commercial horticulture agents with what we've got in the county and 1.9 field crop agents. Ag leads, Gold Leaf, the chamber, the dean, the director, and the chancellor are all fully supportive of this and are willing to pay up right now 50%. Their half of the salaries and the benefits. And they think there's no better place or time than to implement this in Sampson County. And I do not want to throw this on y'all now, but the fire's hot right now and it looks like it's just struck in the past couple of weeks since we started this hiring process with our field crop agent and our AA here in Sampson County. To do this, what I'm coming in here and asking for is half a position for a horticulture crop agent. And that would be an ask of $50,000 to our salaries, and that would cover salaries and benefits, to cover the county salary portion to hire that new commercial horticulture position. What I've done so far is out of the position that is the retired position, I've reallocated $19,224 from that position to hire the new field crop position. It's going to take $5,700 more to hire the field crop position than what we had allocated for the previous field crop position. We reallocated $2,700 to a livestock agent that's taken on 0.25 FTEs of that small farm job. We've reallocated $1,112 to the AA position that is coming on with 12 years of experience and a 4-year degree in accounting. And we're going to have somewhere about $10,000 to offset this new position in our current budget. So basically, it's going to cost about $44,000 with my math. I'm going to need somebody to check my math because I'm not a math major. And I don't have an AA at the office right now to check my math, but I need somebody to check it for me. Lynn normally did all the checking behind me. I don't have anybody there to do it. So this is, and I'll pass these around. This just tells you what we've reallocated. And what it costs. And like I said, I hate to throw this on you tonight, but it's now or never, and this is just something that's popped up the last 2 or 3 weeks. And I know you got 1,000 questions about it.
For the first year, we have matching funding possible for that horticulture position, correct?
Yes. It's the first time NC State's come forward and said we want to do this.
Okay.
If we can get the county to match it.
What's the potential for recurring funding?
From NC State,
Yes, sir.
it'll be every year. And it'll be the same way with the county. And that's the thing about this is recurring funding for the county as well.
How many people do you have on staff in budgeted now?
13,
13 budgeted positions,
Yes.
and how many vacant?
4,
Or
3 resigned, 1 retired.
is there any way one of the vacant positions could be cut and then reinstituted in this? That way the county doesn't actually lose any money?
Well, the retired position is.
Yeah. You see what I'm saying? You cut a position, then you recreate a new position.
Right.
So the net impact of the county is 0.
Right. Well, according to the ag leagues, we're already 1.6 and 1, that's 2.6 behind.
Yeah.
According to the amount of farmers and our waste producers, pesticide licenses, vegetable producers.
You're not looking to lose a position, you want to gain one.
Just 1 out of those 2.6.
Okay.
And we've out of that retired position, which was the small farm position, we've reallocated those duties to some other agents in the office. Like I've taken over the pesticide responsibilities, so I'm doing that. One of the livestock agents has taken over the rental programs out of that. He's doing that.
That is a lot.
It's a
Your
lot.
plate was full to start with.
It's a lot.
To keep adding on to it is gonna help.
There's been many a day I've sat down there at 6 o'clock in the morning wondering why I was sitting in that chair.
Brad, the 2027 manager recommended budget of $777,562. That's not incorporating this current.
It is not.
So that would need to be changed if we were to actually move forward with your request.
That's right. And it's not including that extra 1,680 in that gas, oil, and tire. I mean,
Board members, would you like for us to explore further discussion with Brad about that position and
I would like to see you bring him in and let's just, and you two sit down and have a talk about the direction we're going in as far as that position. I understand his concerns, and being from the ag side, I understand a lot about it, probably more than I should. I'm trying to be very thoughtful of what I know he's going through. And, but looking at that, I mean, we're talking about an $829,000, right, $830,000 budget from 777, so I think it's, you know, if you will, we need to take the time for y'all to really sit down and look at it as we move forward in this budgeting. We need, that's money we got to find.
absolutely.
I mean, I welcome the thoughts of what we're getting from the, our investors with the NC State and all that. Don't get me wrong, they're really helping us out, but, could have picked a better time.
Man, the last 2 weeks has been a whirlwind. I mean,
Yeah.
it's just been.
So everyone will know, Brad come by my office Saturday and we sit and talk a little bit about this. And, because I had some people in my office that had mentioned this to me also, and then they went and got Brad. I said, I'm not making a move on this, you talk to him. And I was that way, so, Now, if you will, need y'all to sit down, then I think we could kind of go from there. And I understand what all been put on the table, but I want to make sure that everyone on this board understands what's on the table. It can't just be one vote. Okay?
Sounds absolutely fine.
All right.
I think that's why.
Any more
Any other
questions?
questions, anybody else?
I think we're good, brother.
Thank y'all, and sorry to bring this tonight.
You need this back, Brad?
No, y'all can have that and look at it.
Thank you, Brian.
Thank y'all.
Thank you. That's good.
Come on up, Soil and Water. We're rolling.
How are y'all?
You got any surprises?
No surprises.
Okay, just checking.
Yeah, we're in the site relief. I'm not asking for anything additional. I kept the budget where it was last year. You should have copies of our Fund 11 and our Fund 28 budget. So with the funds that you provide, we're able to provide a service to the county by protecting and improving the county's natural resources. We take technical, financial, and educational resources and administer our programs designed to encourage individual responsibility to conserve, improve, and sustain our soil and water resources for future generations. Between our office, Sampson Soil and Water, and the federal NRCS staff, we work as a team for the farmers and the landowners in the county. Together, we provided over $2.76 million in conservation incentives during the 25-26 program year, which is not quite over yet. These funds go out in the form of direct payments and incentives to farmers and landowners to install on-farm conservation practices. State funds, we've awarded over 23 contracts. We still have about 50 left on file, and we've paid out over $136,000 in federal funds. We've awarded 41 contracts. We have over 300 still on file, and about $2.3 million in funds. Of course, there's more federal money than there is state that's gone out. The STRAP program, which is a stream flow rehab assistance program where we work with the Caheri tribe and the Friends of Sampson County Waterways. We've spent we've paid out over $318,000 in that. So these numbers don't include just technical assistance, or don't include just cost share numbers. We do have some technical assistance that we provide to the public for free, where we help other offices and departments. And I do have a copy. This is our most recent annual report, if you'd like to look at that. The new one's not ready yet because the program year hasn't closed out. But if you have any questions about our budget, I'll be glad to answer them.
How many do you have on staff?
We have 4 full-time staff,
No vacancies?
no vacancies.
There's 5 on your board, I see.
You said a minute ago you provided $300 and some thousand in grants. What was it you said? And you mentioned the Caheri tribe.
Yes, it's the Stream Flow Rehab Assistance Program. We work with the Caheri tribe and the Friends of Sampson County Waterways. So the state has funneled some money to help clean those waterways out, and we assist the Caheri tribe and the Friends of Sampson County with managing those funds.
And how much was it?
318,000, little over 318,000.
But that's not on the budget here, so.
No,
Okay.
that's all money through the state. That goes
It's just
directly.
It's just passing through.
Yes,
your office.
yes. We kind of help the tribe and the Friends keep up with the paperwork end of it.
But does it actually come into the county? Because if it does, it should be in the budget.
No, it's the Caheri tribe and the Friends of Waterways is using that money to pay people to go out and keep the waterways clean.
Yeah.
But it's not,
But the
it's
money
not.
never actually comes through the finance office?
No,
Okay.
no, it goes straight to the tribe and to the Friends.
Okay.
And you can read, I think there's a full page in there dedicated to that.
Rude.
here at Bonnie behaving.
Most of the time.
I went to high school.
Okay. We're glad to have him on board. He's
I was
our
a year-
newest member.
I was a year ahead of him.
Okay.
Any more questions? All good? I do tell them it through the books.
Thank you, Bruce.
Yes, those are yours, and if you need any additional information, just feel free to let me know. I'll be glad to get it to you.
Appreciate it.
Thank you. Public Works, you up, brother?
Afternoon.
Good afternoon.
Hope everybody's doing well. I'll have to bear with me. But I promise we're gonna get through. You like to start with building? Order.
I'm sure you had two folders, you reviewed the roll. Water's my first, I'm about to keep, I'm going right where I got an order.
All right.
Now, before you start, does this show that we've changed the positions to, in his budget already?
Yes, it's reflected in there. Yes.
Thank you. Roll on, brother.
Yep.
Sorry.
So in order, on the capital outlay, we had 39,125.82. And in contracted services, it was looking like 575,216. And the equipment was like $4,702. Operational expenses, $1,833,847. Debt services, $1,025,530. And salaries is $1,168,834. For a total of $4,697,000. Projected revenue, we're looking at $5,175,528. And that leaves $478,324.18 unallocated.
Positions, in water department, how many do you have?
We have 8 as far as utility staff and 3 office. And then mine would be 1, because I'm half, it'll be split. And then Mac Ellen would be another one, so that would be 14.
How much?
There's 18 altogether, so that would be 14, I believe.
14.
18 altogether.
For the whole department.
Okay. And that's all water.
14 is for water.
Okay. And you don't have any vacancies?
Well, we got 2 that's done away with.
That are done away with. But none going forward.
Not at this time. And we're projecting our water revenue, our sales revenue to come up some. Hopefully by June, Johnson County will be coming back online, so that'll be revenue earned. So that's usually around 35,000 a month.
How much is that?
35,000 a month.
Per month.
How did you address their issue about the quality?
So we've got a treatment plant coming on board. We're waiting right now. Only thing we're waiting on is for Adage to be scheduled to come out and do a startup and do a training and give us our SOPs and stuff. And hopefully if we can get, we could start it up now if they would come on. So everything's been addressed, everything's been fixed. We actually got the contractor to come back out and finish the job. So hopefully within the next week or so, we're gonna be started up. We're gonna flush all the lines all the way down to Johnston County. We're gonna invite them to come over. We're gonna let them look at what's going on. We want them to see that we're providing them good, clean, quality water, that we're not sending them anything discolored or anything like that. We want them to be able to see it. So, and then we're gonna turn it on and turn them back on. But we want them to come, we want to invite their public works staff, county manager, whoever to come, and let's look at that and let's see, so they can see firsthand what we're sending.
Okay,
And then we turn it on.
that sounds good.
How much is that gonna offset us from what we're doing in Harnett County? How much we buy from Harnett County? I don't know that figure.
I think we're contracted for Harnett County for like 18 million gallons.
That's what I was thinking. That rings a bell.
Okay. That's a lot to go through. I'm sorry it's taking me a little bit.
I don't know, it's 18 million per month. And how much is the purchase price for Harnett?
Purchase price from Harnett County is
I think about 3.
cannot remember right off the top of my head. I know a purchase price from Clinton is, $225.
About right. Harnett County runs us about,
Okay, I've got you right here. Bulk water purchases for the city of Dunn is $300,000.
$300,000. Is that a month or annually?
That's annual.
And how much are we selling to Johnston County?
35,000 a month.
Yep.
35,000 a month.
420,000,
For what?
420,000 annual.
So we're basically having to buy water from Dunn to subsidize what we're contracted to provide Johnston County.
And we're and there was a 30-year contract entered in with them.
That was a very wise contract.
But I'll agree, 100%.
We've had that conversation a few times.
We've had that conversation a few times, and
I'd rather 30 years.
my thing is I will put down there one over 5 year with option to renew after that. But anyway, so any other questions as far as the purchase of water, sale of water?
You're doing fine.
And the reason we buy is to compensate for what we can't make up as far as going through. We have to have that to meet state standards.
No.
So if we don't buy any, we won't meet it right now. But hopefully that's gonna change in the future, homecoming week and stuff like that we're hopefully trying to put on.
How much money is currently, and you probably don't know off the top of your head, but how much money is the enterprise fund currently?
I do not know, Melissa, did you know?
No, right now.
I do not know.
Is that something you can email the board later?
Absolutely.
Thank you. I'm good on the water.
All right, you're up next. Everybody else get on water?
Buildings.
Bills.
Buildings.
in buildings, we raised the shade a little bit off this year. So the capital outlay, about 455, 171. And then the capital outlay vehicles like 457, 769. Contracted services, 479, 021. Operational expenses, 989, 506. Salaries, 506, 320. For a total of $2,487,787.60. Current year budget was $2,744,630, for a difference of $256,842 that we've been able to shave.
This shaving, does it jeopardize the 10-year plan
No,
for
sir.
replacement?
No, sir.
So we're online with HVAC and
Yes,
everything?
yes, sir. And we're still online with all the building stuff and all like that. The only thing that we were not able was one line item for courthouse was for $250 to replace the heating and air, and that is not going to work. That will be definitely more than that. So that's the only thing that we've had to.
Plus you've got some situation with electrical.
Yes, yes. Shorter renovating the whole place would be replacing that. So.
You to put something in, you gotta take something out.
Yes, sir. If you
What I've
put
been
it in,
told.
it's got to take, that's what I've told everybody that comes in, even the state. If the state comes in or AOC or whatever like that comes in and says, hey, I need to put new equipment in a courtroom, I say, okay, why don't you take it out? I said, because we can't keep putting in, we've got to take something out because we are at electrical capacity right now and have been for years. This is just not started.
So you said you had 6 on the building side, 6 on
Got
boards?
5.
5, and 1 vacancy.
No, sir, no vacancies on the building side.
So most of the cutting that you were able to do over last year's budget is from capital to outlay? So you expensed money last year for capital outlay that won't be going forward? Is that where the savings came from?
That, and let's see.
And I know you have the director position
Yes.
that's the savings. But that doesn't account for the full $340,000 that was saved.
Forward thinking to the next fiscal year, of the 340 we're cutting out, what percentage are we gonna have to add back, or?
Shouldn't have to add none back. It should be pretty level across the board to be able to accomplish all the goals that has been set.
You feel comfortable with fuel expense? No, nobody else
No,
does.
sir. Not at all.
So Commissioners, I do want to share with you, one thing we have looked at is we increased the contingency line item over what we had prior year, thinking that if this holds out with fuel, we would be able to utilize that to help the departments.
For fuel.
Okay. Capital outlay vehicles, 57, 124. So you think you're good on vehicles for 2 or 3 years?
Yes, sir.
Okay. I'm asking. I like the plan. I'm gonna be sure I'm on board with you.
One thing to note on their budget is that for this fiscal year, used a large chunk of money out of the building reserve fund, close to $1 million.
Yes.
Because of the front end, first year heaviness of that capital improvement plan. That was the source of the funds that Mr. Hudson pulled that from. So it looks like this year, or this coming up year, they're able to incorporate it into their regular budget, the updates that need to be done to keep up with the capital improvement plan.
How are we doing with capital improvement plan?
It's coming along good, we're still on board. We're getting the bowls replaced, getting all that stuff done, getting ready to put the carpet down. And the buildings that is listed on there, I think one of them is, let's see. Gonna do some time adult daycare, then EMS is gonna get their, air conditioning stuff, let's see. There's oh, it's all right, I've got it here, I just had fun with those.
We did review it,
I just, we put a lot of foresight in that plan to make sure we stick to it, because I don't want to do the paving now, paving later.
The gutters will be done, the awnings on the buildings, and all that'll be done. There's $100,000 in there for sheriff's office for HVAC. That's in the budget for this year. The replacement of the vinyl.
That's even, let me jump in.
Yes, sir.
That's even with the additional HVAC work that's already been done.
Yes, sir. That's added too, so that's not fixed, that's added too. The tile floor in the adult daycare is up in this budget. Replacement carpet for board of elections is in this one right on. The exterior glass panels at J.C. Ottley Library, that's gonna be done. I said the winter awnings, and the awnings at the courthouse extension. It's all that there. So it's all gonna be in there. Like I said, the only thing that we did have to cut out was the we did just take it out was the 250 for the replacement of the heating and air system in the old courthouse, in the main courthouse, because it's not feasible. We were told that, we had experts come out and look at it and say, nothing short of that.
Okay. Thank you.
All right. Let's see what it is. Any more questions? Thanks, sir. Appreciate it.
Thank you.
Thank you.
You did a good job being put on the spot the first time.
Oh, it's all right. Been there before.
You certainly prepared.
You did good.
Thank you.
Well, it's 5:52.
Well, and I just asked Miss Patty to come over so we can go ahead and knock it out.
I'm ready, that's what I was gonna say. I've done a glance there over there. I was gonna give her the nod and see when she was ready. She looked ready to me, so I said, come on.
Well, I am waiting on Jay Logan and Anita Carlton, but they'll be joining us.
Oh, they're coming in the door. I can read it. Okay, we're glad to have you. If you will, you take off and run with it like you want to do, and we'll go from.
Okay, well, this has been a very difficult year, I would say, for our DSS budget. Several different factors playing in at one time. The most notable, I think, is the HR1, where that's going to cause additional expenses due to the decrease in reimbursement. And that is already effective this coming up budget year, with potentially more to come next budget year. Another major influencer is our temporary staff. So several years ago, we began not filling clerical positions and abolishing them or reclassifying them to other things and filling that work with temporary staff. And that has been happening for over 10 years. So the number of actual permanent clerical staff within the agency, very, very slim. This year, with the new IRS changes and the labor law changes, we are not able to continue to have temporary staff. Therefore, I did request additional staff in the budget to make up for these lost temporary workers. Now, I've seen our recommended budget, and those have not been included. And we have worked very heavily with Nancy and Mr. Van to identify areas and where we could, restructure and change things and automate a little bit more. And we have identified a vacancy and 2 current positions that we could reclassify in order to provide support to the clerical unit. So we're looking at the front desk window and in the lobby and in the front desk window in services side, as well as we're looking at a kiosk to streamline checking in. So when clients come in, they can check in on the kiosk that runs on the software that we already use.
Okay.
So I think that would be good as well.
I appreciate you thinking outside the box and stuff like that.
I'm not sure if anything, stands out drastically. Hasn't changed much from last year. Of course, the estimates from the state are what they are. And we can only foresee so much. And then with the HR1, we may have to come back and ask for additional support, but we won't know until we're actually in it.
Okay.
So in your recommended budget, how many full-time equivalents do you have?
152.
152?
Yes, and we did ask for 2 part-time community social services technicians.
And those, excuse me.
Go ahead.
Those are reflected in your spreadsheets.
Okay. And your current vacancies are how many again?
We have 1, 2, 3, 4 right now.
4 vacancies. How long have those positions been vacant on average?
We have 2 income maintenance Medicaid supervisors. One of them has been vacant for some time. That one we reclassified to a processing assistant 5 for the front desk. Then I just got a resignation last Thursday or Friday? Thursday. So that is the one that's posted. And it's gonna be very tricky to fill that one. The other one that was vacant is very tricky to fill, and we've classified it to provide that support elsewhere. So it's a tough one, but we have several Medicaid staff that need supervision. We need somebody to supervise these staff members. And it's just hard. We're not competitive, so it's hard to get applicants in for these positions. I have today received 2 e-references for employees from Johnson County. And that's today. They have been hitting our social work staff pretty regularly. Lost 2 in administration to them, and now it's hitting our eligibility side.
It seems like we're losing everybody in Johnson County.
Yes.
What can we do about it? If Burlington's here, we can ask them to close down 701.
And you don't have any vacancies in child protective custody or services, I should say?
Not in child protective services, but we do have 2 in foster care. 2
Foster care
2
positions.
positions?
Yes.
Okay.
Which is unique because normally we have plenty of vacancies in both of those sections. But right now, I mean, this is, I don't know the last time we've been this fully staffed in child welfare. We have 9 positions in child protective services, and last year at this time, we had 4 that were actually operating. So we had those vacancies and then some that were out in the mail and some that were in training. So we, out of 9 positions last year, this time we had 4 actual investigators.
And on the 28th of April, we transitioned into our new automated system called PathNC. So we are on week 3 of that.
So what's gonna happen to the temporary positions? They just gonna go away?
They're just going to go away. We have encouraged the temporary staff to apply for permanent positions as they become available.
They were through a temporary agency.
Some of them can't apply for it. Full time because they retired.
That's correct.
So they just put them out of work.
having positions that
Urban.
you're losing to Johnston County in most of those cases is due to salary?
Oh, yes. Because the work is the work. The work is hard. And we're talking anywhere from 10,000 to 20,000 more.
Yeah.
But they have a lot more cases.
They have a lot more
They
cases,
have
but
a
if
lot
you're gonna
more
do,
cases than we
if you're
got
gonna
over
do
here.
hard work, I guess the mindset is if I'm gonna do this hard work, I might as well be compensated for it. And I'm willing to drive further.
Extra amount.
So,
And my supervisor that I'm losing is going to Johnston County to do eligibility. She's not gonna be a supervisor. She was offered supervisor, she was offered program manager.
Yeah.
She turned both of those down. She's just gonna be a regular eligibility worker. And she said her salary's a lot more than what she makes now.
As a supervisor.
Yeah.
Johnson County.
Yes, that's exactly, yes.
And that's not the only county that we lose staff to, but that seems to be the hot county right now that's pulling staff away.
According to the Johnston County Commissioner, they're doing this to us because Wake County is doing it to them.
It's past the buck time.
leave one out of the cycle.
Yeah, exactly. Thank you.
Would those temporary persons take part-time if we could offer it?
If these 2 part-time positions are approved in the budget, they are more than welcome to apply.
But we're not gonna have enough positions for them, for all of these temps that we're losing to apply.
Okay.
And just to reiterate, so everybody watching understands, this is a federal regulation that we're having to comply with to do away with the temporary.
Yes, and
Yes, sir. As far as a long-term status or solution, yeah.
So you're asking for how many positions?
We narrowed it down to, is it 13 or 14?
I think it was 14.
14 positions. However, you know, times are tough, and we recognize that all the way around, and we have shifted things internally to be able to sustain until we're not able to sustain anymore, and then we'll be back. But for now, we have shifted internally to meet the demand.
And we really appreciate all that you've done.
Thank you. I do believe that the 2 part-time transporters will be very, very helpful.
I know they will. They're gonna be needed too.
So again, Commissioners, as she mentioned, as far as HR 1 impacts truly take effect after October 1. So we thought, you know, at that time, we'll see what's truly developing and what, you know, what needs there may or may not be. We just don't know for sure yet until we get there.
We truly want to thank you for all y'all do.
Thank you.
Yeah.
thank you.
Thank you.
Thanks for listening to me.
I know what it is, I don't do it.
Yes.
All right, that concludes our business for tonight on May the 11th. We skipped our lunch and our supper is still back there, correct?
It's back there.
It is.
So we will go ahead and adjourn and eat. Is that good with you?
Yes, sir.
We will we're gonna, recess to reconvene. I'll take a motion on that for Monday, May the 18th.
Make such a motion that we reconvene on May 18th.
Second.
I have a motion and a second, all in favor? All right, we will reconvene, or we will recess, at recess, excuse me.